Hi, I'm Dr. Pranay Kapadia. I'm an ophthalmic surgeon practicing in Mumbai, and today we are going to talk about glaucoma. Glaucoma is a sight-threatening thief, and it is a silent thief. Now, why do we call glaucoma a silent thief? For that, we have to understand what glaucoma is. Everybody feels that glaucoma should be equated means the eye pressure is high. So high eye pressure most of the time is right, that it's something similar to what a blood pressure is. When the blood pressure goes up, it's called as hypertension, whereas when the eye pressure goes up, it's called as glaucoma. But glaucoma is not just that. It is basically a disease of the optic nerve. When the nerve starts getting damaged, that's the time that the patient experiences some symptoms or may not experience symptoms, but the doctor will diagnose the patient as glaucoma. Now, what exactly is the optic nerve? Optic nerve is a nerve which connects the eyeball to the brain, and it sends signal just like the camera. So a camera is equated with an eye in which the images from outside are captured onto the retina, and the cable which connects the camera to the laptop or your computer, the computer being the brain. This particular cable works just like the optic nerve. So this is the main simile that we have to understand. As you can see this diagram which is below, that from the eye, the optic nerve transmit all the information to the brain. Now, in glaucoma, suppose this cable stops working. The camera is clicking well, the laptop is doing well, but the information from the camera is not reaching the laptop. So the eye is doing well, but the pressure is high. So the nerve starts getting damaged, and the brain is still working well, but the information is not getting transmitted to the brain. So what is the role of eye pressure? Generally speaking, intraocular pressure of anything above 22 should be considered as glaucoma. This is a general rule. But there are some patients in whom the pressure is low, but the patients can still have glaucoma. So anything above 20 should be considered as borderline, and below 20, you should just keep a watch if the patient has any other risk factors. The eye pressure, there has to be some amount of eye pressure inside the eye to maintain the stability of the eye and to maintain the pressure inside the eye so that it gives a good shape to the eye. And if the pressure goes up, then the high pressure would damage the optic nerve, which lies at the back of the eye. So how the pressure builds up? You can equate it with your wash basin. So if there is a tap in the wash basin, which is an inlet, and there is a drain, which is an outlet. So imagine water is flowing in and the same amount of water is flowing out. So this particular basin remains at a normal shape, normal size. Now suppose the amount of water which is going in remains the same, but there is a blockage at the level of outflow. Then the entire basin will get full. Now, because the basin is an open structure, the water can come out. But imagine the same thing happening to the eyeball. Eyeball is a totally closed structure. So the amount of pressure which gets built up inside, it will get transmitted to this optic nerve. And then this optic nerve starts getting damaged. How does it damage? Pressure from all these regions will go to the optic nerve because the main outlet towards the pressure is going to be directed towards the posterior part of the eye, which is the optic nerve. And how does this happen? What are the causes? The main cause is the outflow drainage obstruction. The fluid has to be in a dynamic flow. That means there has to be a fluid going in and there has to be fluid coming out. Any amount of stagnation of fluid will also lead to increase in the intraocular pressure. The fluid inside the eye is called as aqueous humor. When the patient has glaucoma, What does a patient come and complain of? Nothing. Most of the patient, a majority of patients are totally asymptomatic. And only when the glaucoma becomes in a progressive stage, that is the time patient starts experiencing certain symptoms like blurred vision, eye pain, headache, halos, nausea, vomiting if the pressure goes really high, and colored halos and rings around the lights, and the redness of the eye. And how will the glaucoma progress? In the early stage, the patient may see a small little black spot in the vision. This black spot can expand further, and then the black spots can appear in another part of the vision, and the field of vision starts getting restricted, and it finally leads to blindness. That's the reason why we need to be very careful about treatment of glaucoma. So understanding of the glaucoma also entails that we have to know what are the different types of glaucoma. So broadly, we divide glaucoma into an open angle glaucoma and a closed angle glaucoma. So what is this angle? As you can see in this particular eye, this is the lens and this is the cornea. In between this particular region is what is called as an angle of the eye. So a fluid that is aqueous humor is produced from behind, it goes in front and it goes into the angle and then it gets drained out. So this is what the normal mechanism would be. Now imagine this particular angle is open, but there is still glaucoma. That means there is an outflow obstruction in the sieve-like structure, which is called as a trabecular meshwork. And that gets either sclerosed or it gets obstructed and it leads to glaucoma, although the angle is open. And this is called as open angle glaucoma. And it's called as a primary open angle glaucoma because there is no apparent reason why this happens. It's just that the patient is genetically predisposed, and that's the reason why the glaucoma would happen. As opposed to this, if the angle, which I had showed before, if the angle starts closing because of some reason, then there is an actual obstruction of the flow of fluid going into the trabecular meshwork. So trabecular meshwork does not get enough fluid, so the drainage starts going down and the patient experiences high intraocular pressure, and that is called as the closed angle glaucoma. How do we diagnose glaucoma? So there are various different tests. Glaucoma is not something which can be diagnosed by just one single test. Now, why is that important? Because glaucoma is potentially blinding disease, and it is a very complex disease. So if the disease is so complex, the test also will have to be multiple. And if the disease is sight-threatening, then we better not miss this particular disease. So we check the eye pressure, we check the optic nerve, we check the field of vision, the angle, and the thickness of the cornea. So eye pressure test is called as tonometry. The shape and the color of the optic nerve is called as ophthalmoscopy. Field of vision is called as perimetry. Angle is called as gonioscopy, and thickness is called as pachymetry. And after doing the diagnosis, we need to treat. Luckily, now we have very, very good drugs available with us. We used to import certain glaucoma drugs, but luckily now we have drugs from all over the world, including Japan, including USA, and very good medicines in the form of drops are available. So more than 90% of glaucoma now is being treated with just the medications, which is the first line of treatment. And as opposed to this, maybe 40, 50 years back, surgery was considered as the first line of treatment. Now the surgery is almost a third line of treatment for the patients in whom the medication nor the laser can work. Then we go for surgery. So the medications are such that one need not take the oral medications. These are just the drops. Also, the drops are so effective that most of the time patient has to just put one drop just before sleeping or maybe 9 o'clock at night, and the glaucoma is kept under control. Control of the glaucoma is a very important word. It is not a disease which can be eradicated. It is a disease like blood pressure, like hypertension, like your diabetes, that it can only be kept under control. it cannot be cured. So till the time the patient is on the glaucoma medications, the pressure will remain normal. Afterwards, the pressure can go up if the patient starts missing the dose. Now, in spite of taking medications, certain patients do not get control. So we go to the next stage that is called as a laser. And in that, a highly specialized laser machine will make an opening into the trabecular meshwork so that the trabecular meshwork starts opening up and the amount of fluid which is drained out, the aqueous humor which is drained out, will increase. And if that also fails, then one has to perform a surgery in which we make a valve kind of opening and the single flow of one-way flow of fluid from inside of the eye to the outside of the eye is created. Who are at risk for glaucoma? Very, very important question, because the population has to understand that whether we need the eye checkup, whether we need a specialized eye checkup for glaucoma. So who are the people who need this? Most important thing in the center is written family history of glaucoma. Very, very important, the most major risk factor. Second, people of the age 40 and above should have at least the pressure checkup. People who have had high intraocular pressure in the past, those who have had thin corneas, those who have nearsightedness or high myopia. These are 5 important factors. Other factors are those who have taken steroids for some other ailment for a longer duration, those with blood pressure and diabetes, those with thinning of the optic nerve, and those who have had an eye injury. So these are the patients who should have a regular glaucoma evaluation, regular checkup, and maybe if required, specialized tests for glaucoma. So in a nutshell, glaucoma is a disease in which some patients could have had high intraocular pressure or some have damage to the optic nerve without an elevated intraocular pressure. And this optic nerve damage will lead to visual field defect. If untreated, can lead to visual field loss. So the most important thing about glaucoma is awareness that this exists, understanding that this is a silent killer. So one has to do an examination, which has to be something, if you're 40 years of age and if you're myopic and using steroids for a long term, then you have to do an eye test once every 6 months to a year. But if you are a glaucoma patient, depending upon what kind of treatment you are on, one may need treatment or visits to the doctor as early as once in 3 months or every month, or maybe once in every 6 months. And certain tests, which we have already mentioned, they will have to be repeated on a regular basis, on a regular interval. Now, one also must understand that the vision lost cannot be regained, but further loss can be stopped. So timely diagnosis and appropriate treatment are the key for glaucoma prevention. So thank you very much for your kind attention.
Thank you so much, sir, for your precise dissemination of the slides, and it is very much useful for the patients across. And we'll be sharing the link shortly, sir, once it gets generated.